I'm David Gibson. I'm an orthopedic surgeon specializing in hip and knee replacements. In the last 30 years I've been in practice, it's changed dramatically. The materials are better, the techniques are better, and so we do stuff that we're expected to last 30, 35 years. When I first started in practice, the average patient came in the day before surgery and stayed for 2 weeks after hip or knee replacements. We're now doing them as outpatients. It's the same operation with a better outcome. And the techniques we've learned over the years has facilitated those outcomes. Working now in this community of innovators and thought leaders is wonderful. So learning to think, teaching, helping patients, it's a great job. The patient satisfaction is wonderful. Mrs. Jones comes in, she has trouble walking, she has trouble climbing stairs, she can't do her thing every day, and you replace her hip or you replace her knee, and a year later, they're doing great. They're having fun, they're walking around, they're not thinking about their joints don't hurt anymore. It's just a great time to do this and a great field and a great transformation for individuals.